Hi friends, so this is your friend Arun from Live in Germany channel. So today I'm back again with another interesting topic and also a less spoken topic, preventive checkups which are covered by the public health insurance. So immediately someone will ask, what about private insurance then? I mean, private is also providing these health checkups for in their coverage. They also have additional that we'll see in separate video, or if you want, you can book an appointment directly with us to understand it more. So that's a different topic. In this video, we will talk regarding what preventive health checkups are available for adults 18 plus, and also in detail what is the general checkup, what guidelines are provided and available. So again, I'd say like this is not any kind of medical advice or tip, but just making an informative video for your awareness, so that just because not aware of something that exists, we might not use it. Maybe this video will help you and motivate you to ask more questions, research yourself, and take preventive measures, because health is more important than money. Now to the video. Hi guys, so like I said, like health is more important than money. So like same way for YouTube channel to run, likes and subscription is also important. So if you like this content, feel free to click on the like button so that it reaches more people, and also it shows us that such different topics, like compared to usual how to move to Germany or how life in Germany, this could be a little bit more interesting or not. I can find out by your response. So please show your support. So now to the topic of preventive checkups. So when I say preventive health checkups, so the question which pops in mind is, okay, I had a cough and cold, I am going, is this preventive medical health checkup? No, this is not preventive. You already have a symptom, so that is a normal medical health checkup. So preventive health checkup here I mean is, you are completely normal and then you want to regularly check the status of your health and to prevent something that could occur in the future. So this is what we mean by preventive health checkups, which are covered by the public health insurance company. Hi guys, so you can see on the screen like it's in English, but actually it was in German, so there could be small differences in translation. I hope it is correct. If not, then I'm also sharing the original German file in our Facebook group, where you can join and download and read yourself to understand this. So I will talk, like I said, about the general checkup, and then we'll go gender specific. So here I'm talking about general plus women, and then later on to men. So just to give you an idea, from the age 18 onwards up to the age of 34, once you can have a general health checkup. Whether you are male or female, this is what you can do. Only once you can do between 18 to 34 or up to 35. And then from 35 onwards, every 3 years once, male or female, you can take a general health checkup. Only differences from the 35 onwards, you can also, if you want, you can also check yourself for hepatitis B and hepatitis C infections or early detection of this. And also there will be a little bit more detailed examination of your blood test, so which also I will cover in the later part, where I'll talk about more about the general health checkup. In addition to that, both male and female have something in common, is the skin cancer screening, which is also after the age of 35. Every 2 years once, I think you can take. We will see the details now. So first, I'll like I already told about generic. So now to the part which is covering women, for example. So when you are, of course, alter age, a small translation thing. So from the age of 20, I will not go detail into what these screenings are, but rather I'll touch the topics, so that we can save some time, and also you can look into it detail later on. So first of all, from 20 onwards, annually you can check yourself if you're a female for cervical cancer or genital cancers. So this is possible by doing it regularly as per the suggestion. This is not mandatory checkups, this is voluntary checkups which are covered. That also I repeat. So you can make use of it. So additionally, from 30 years age onwards, you can also check yourself for breast cancer. They will also give you instructions on how to check yourself, self-examination, and when you feel something, you can go to the doctor for further stuff. Likewise, from 35 onwards, which I said, like they will have this addition checkups for hepatitis B and C if you want. But there is also a thing, if you already have a vaccination for hepatitis B and C, whether you're male or female, you might not require this blood test. But yeah, just letting you know. So I already spoke about the skin cancer part detection, which is for both male and female. From 45 years, that's for male. So from 50 years onwards, you can have an additional this mammography screening every 2 years until the end of your 70th age. So this could be informative for you if you are somebody here more than 50 or might be reaching 50 in the next years. This you can understand. And also early detection of bowel cancer or bowel cancer screening. So both male and female actually has this from 50 access to this, but I think the approach in which they detect is a little different for male and female. So we will not go into the detail, but in this PDF you can read later what is that exactly. So from 55 years onwards, if you're a female, then you can also go for this early detection of bowel cancer. But this time it is using, for example, colonoscopies every 10 years. So sorry, colonoscopies. So colonoscopies for every 10 years. So you can do this at free of cost when you are an adult. So this is what I'm talking about for females or women. And also the generic stuff. So now let's go to the men. So we have already done with the checkups which are covering for women in public health insurance. So for men also, this general health checkup I told already is covering from age 18 to 35. Once you can do this checkup. So what are the contents? We'll talk like I spoke. And also the same thing here, what you see is like after 35, men can also do a health checkup every 3 years once. And on the right side, you can see like what kind of things they will take, and also the thing about hepatitis B and C, which we already saw. So likewise, also for the skin cancer, men can also have access. In addition to this, when you're crossing, for example, the age of 45, you can do this early detection of cancer of prostate and external genital parts. So this is yearly, you can do this. And likewise, once you cross the age of 50, like I told for women, you can also do the preventive health checkup for bowel cancer, so which is also kind of seen something important in Germany. If you are in this age group, please have a look. And once you get older and older, you can also have more access to early detection of bowel cancer with the different like every 10 years once you can do this. And also once you cross, I think, age 60 or 65, you can okay, let's check that out. Early detection of abdominal aortic aneurysms. So I hope I pronounced it correct. I'm not sure exactly what is that, but once I reach this age of from 65, maybe I'll find out at that time, or maybe I'll Google it. But just for letting you know, these are the possible health checkups what we can have in public health insurance. So you can read this PDF in detail later on, but just to give you an overview, this is what is possible. So I think some of you asked regarding the dental health checkup. So I will not go much detail, but just to give you a short info, from 18 years onwards, you can go every half calendar year, like every 6 months from Jan to June, for example, once to do your dental health checkup. So if there is some kind of hard deposits or something that also can be associated, they can remove that during the checkup. And then there are some bonus programs from certain providers, public and private, if you do regular dental checkups. So this is like how this works. And also there is some kind of extra screening, I think periodontist or something. I'll put the name on the screen, as you can see. So for this screening also, you can make use of your public health insurance. Now we will see in detail what are the contents of a general health checkups, what are the information we find, and what is done by the doctors. So again, so this is like guidelines given for how a general health examination should be performed. So I already told, just repeating, up to the age of 34, you can do this only once. Yeah. After 35, you can do it once every 3 years. So we will see as per the guidelines. This also is in the Facebook group, so you can read later on. But just for you to idea how this works, this is the contents. First, the doctor will ask regarding the medical health history of a patient. For example, if I go for this, they'll ask about what is the vaccination status, if we have hypertension or any kind of diseases, diabetes in the family, kidney diseases, lung diseases, and also most importantly, personal risk factors like obesity, nicotine abuse, alcohol, or emotional stress. So for example, during time of Corona, myself, for example, I didn't do a lot of physical exercise. So I'm starting to do now, but that also is kind of a thing which they will ask for, and then we have to tell, and they will make suggestions about that. So then the next step, what they do is go for clinical examination. So they will check, for example, our inspect the chest, cardiac oscillations, and foot pulses. So how we are reacting, and these kind of things, and also how is our skin, skeleton, nervous system, what's our body size, weight, and also they check for blood pressure to check if we have that pressure conditions, for example. So this is the second part in which they do the physical examinations in a health checkup. The third one is they're performed in a laboratory. So for example, I already told, like, you can take a blood test, and in this they will be talking about the lipid profile. So in the blood test you can understand how your total cholesterol is, how this LDL, HDL, well, technical terms, but in general let's understand it's fat. So, and also they'll check for diabetes. I think that is why they want the fasting plasma glucose from the age of 35, where you can take every 3 years once the same thing. So they will also do the same tests like in this, and also they will do additionally, like I spoke about, like from urine possibly. They check for protein, glucose, and other stuffs like nitrite using a strip test. So these are the informations what they gather using our blood or lab test. And at last, once all this information is available with the doctor, what happens? So he will probably look at all the details, and they can give us medical advice, suggestions, then tell us about like what kind of movement behavior we should have, what kind of lifestyle change, what kind of nutritions we can add to our life, and also suggest us vaccinations which can be taken in order to prevent some things. So these informations we can get from the doctor once all the information is reported. Yeah. So yeah, of course they have a particular format on how this report has to look like. That's also in the PDF you can read. So once all these results are done, they will document it as per the guidelines, and then they will hand it over to you. So my personal suggestion for you is to go through these guidelines to understand how this public health insurance medical checkups usually, covered by the public insurance works. And also, if you're interested, talk to your house arts and then find out when they have time, and you can do this to understand and keep yourself much healthy. Like I said, health is more important than money. So I hope this video was useful for you all. I'll come back again with another video. So I know like some of you are waiting for the video regarding the gas heating subsidy in the month of December. So there were some updates. That's why I had to change my video, which I already put. It's already online, guys. I will release it probably tomorrow or day after tomorrow once this video is out. So please do stay subscribed to also know how gas heating subsidy works for you. Now, thank you and bye-bye.